Welcome to today's press conference on quarantine arrangements. We have with us Secretary for Food and Health, Permanent Secretary for Food and Health, Mr. Thomas Chan, and Controller of the Center for Health Protection, Dr. Ronald Lam. Shortly afterwards, the three panelists will speak before answering questions. Professor Chan. Friends from the media, members of the public, in recent days, many of you are very concerned about the confirmed case with the mutated virus strain. Given the fact that the mutated strain is more transmissible and there may be a longer incubation period, the government is extra careful. When the first confirmed case carrying the mutated strain has been picked up in the community, the government has taken swift measure to classify all residents living in the same building as the confirmed case as close contact. They were all sent to quarantine centers to go through the 21 compulsory quarantine period. The objective is to stop the spread of the mutated strain. At the same time, the Center for Health Protection has left no stone unturned to trace the places where the confirmed patient has been and where the close contacts or people who are in contact with the confirmed case have been. And we've also asked people who've been to these places to go through compulsory testing. We've done a lot of work in the past 2 weeks, including compulsory testing and restriction and testing declarations. With the hard work of our staff members in the Center for Health Protection and with the large-scale tracing, quarantine and testing work done, we are more or less clear about the transmission chain of the mutated strain. With the cooperation of members of the public, we, at this moment, have not found any outbreak caused by the mutated strain confirmed case. I thank everyone who has been affected for their understanding and their cooperation. You've all been very cooperative in complying with our testing and quarantine requirements. We do understand that there will be inconvenience and you may be worried, but we ask for your understanding that the government have taken such measures in order to protect the health of the community and to guard against another outbreak. We have taken stock of our experience in dealing with the mutated strain case. We think that we can increase the precision of our handling of contacts of the confirmed case. Not all residents living in the same building as the confirmed case with mutated strain have to be sent to the quarantine center. Shortly afterwards, Dr. Ronald Lam of the CHB will give you details. He will also go over the epidemiological basis and details. I'd like to announce that for those people who have received 2 doses of vaccination and have waited for 14 days, there will be adjusted measures in terms of a quarantine period. Those who have completed their vaccination, that is 2 doses plus 14 days, will their quarantine period be shortened? I'm sure you all like to ask this question. According to the latest recommendation of the Scientific Committee on Vaccine Preventable Diseases and Scientific Committee on Emerging and Zoonotic Diseases, members of the public who have completed the vaccination can have their quarantine period shortened. You will hear about it from Dr. Lam shortly. In relation to the quarantine period of people arriving in Hong Kong, that is, if you have been vaccinated, 2 doses plus 14 days, will the quarantine period be shortened? According to the advisory panel, those who have completed the vaccination can have the quarantine period adjusted in accordance with the risk and the epidemic situation of the place or country of origin. Of course, the premise is that they have completed 2 doses of vaccination plus 14 days. You'll hear about the details from Mr. Thomas Chan. I'd like to emphasize that vaccination is the most effective measure against the pandemic. This will help Hong Kong resume normal. On top of that, it will protect yourself and your loved ones. We can swiftly, through vaccination, build a protective barrier. Last week, we have launched a number of measures under the vaccine bubble, and that is in relation to restaurants and other premises. For the policies relating to shortened quarantine period, they are made based on expert advice. This is an important step towards resumption of normal activities. I ask you all to get vaccinated to protect yourself, your friends, and your family, and to get Hong Kong back on track. The mutated strain has been ravaging the world, so please lose no time to get vaccinated. Thank you.
傳媒朋友大家好，我先講咧就本地個變種病毒嗰個情況先。咁啊，截至到5月6號咧，咁就住咧本地感染到嘅尤其係同南非變種病毒有關嘅群組個案咧，係累積有8宗嘅。而嗰個源頭咧，我哋而家揾到咧就係個案編號11643，即係
Case 11643, that is the person who arrived from Dubai. The mutant strain, as we explained earlier, has this characteristic, which is that it is highly infectious, and once infected, the state of the disease will be more serious. Furthermore, the incubation period could be longer than the other normal strain of the virus. So when we have found these mutant strain in our community, we cannot afford not to be vigilant. And I think we have also seen over the past week that the Center of Health Protection and other departments are now working hard to interrupt and to intercept the spread of the new variant strain of the virus. The most important principle is that we need to be proactive, and that's why we've adopted a risk-based approach. The Secretary already said that for all these cases which we have identified, whether or not it involves a family or those who are close contacts through social contact, in order to preempt the spread of the epidemic, we have, for people living in the same building of those of the patients with unknown sources, we have actually carried out, imposed quarantine. Today we've conducted an assessment. I think you remember that the residents in the first building subject to quarantine is the Parks building in Jordan, and the residents in that building by midnight today they would have completed the 21-day quarantine period. We've studied all the data, and we have found that for this first batch of residents who were subject to quarantine, during the 21 quarantine day period, they have all been tested negative. Overall, among the cluster of cases and the variant strain which we have found in the community, So according to our epidemiological survey, and also the living environments and also whether or not there had been any community transmission, we've carried out a series of assessments, and we have formulated the latest quarantine arrangements for the close contacts. If we should find any mutant strain like N501Y of unknown sources, if we learn that there are such preliminary confirmed cases or confirmed cases of such mutant strains, we will first of all, in respect of the premises where the persons live, impose a compulsory testing declaration. And for the same building and the premises in that building, after we've imposed the compulsory testing declaration on the 3rd, 7th, 12th, and 19th day, they will also be required to take a compulsory test. The close contacts of these residents will also need to, within the 21 days, impose self-monitoring. At the same time, we will closely monitor the situation and conduct assessments. That is, whether or not it's the close contacts of the cases, or if they live in the same subdivided unit of a confirmed case. For these persons, we will still impose very stringent measures and require them to undertake a 21-day quarantine. Say in one building, if we have identified more than one confirmed case, we will not rule out the possibility there is a transmission within that building. We will not rule out the possibility of imposing a 21-day quarantine on all the residents in that building. So that is as a result of our having assess the findings of our case studies and have a look at all the data, and this is the arrangement that we have now come up with. Because the N501Y variant, for infected persons with that strain and people living in the same building of the infected person who are subject to quarantine, we will conduct one test, and after we have obtained the result of that, they can be relieved of the quarantine. But once they return to the place where they live, from the time they first leave their building and go and subject to quarantine, on the 3rd, 7th, 12th, and 19th day, we will require them to take a compulsory test. And also for the remainder of the time, they will continue to conduct self-monitoring. For these people who are now subject to compulsory quarantine, who are subject to the new arrangements, we will, based on priority, arrange for them to leave the quarantine center in an orderly manner. The condition being that they have to be tested negative first. So these are the new arrangements for the quarantine. On the other hand, like the Secretary told you just now, today we will be announcing that the advisory panel of the CHP, together with the expert committee, in respect of the close contacts of the quarantine period for the close contacts of those who have already been vaccinated. We now have arrived at a consensus, which will be the details of which will be put onto our website and followed by a press release. The recommendation, includes two parts. First of all, the first part involved people who have already been vaccinated, and it includes the close contact of infected persons who are not affected by the mutant variant. For the close contacts of these subjects or cases, they will need to satisfy certain conditions, and having satisfied those conditions, such persons' compulsory testing quarantine period will originally, they have to undergo 14-day quarantine, and now the quarantine period will be shortened to 7 days and followed by a 7-day, quarantine at home and testing. But they need to satisfy several conditions. First of all, they would need to have proof that they have been tested by they have already been vaccinated either with the BioNTech or the coronavirus virus. They have to prove that they have taken the 2 vaccinations, and also 14 days have elapsed since the vaccination. Secondly, when they go into the quarantine center, on the first day, the CCR, finding would need to be negative. And thirdly, they would need to undertake a serum test. We call this the COVID-19 IgG antibody serum test, and the finding would need to be positive. So these are the 3 prerequisites. Having satisfied these 3 conditions, then the quarantine period originally for 14 days will now be shortened to 7, followed by 7 days of home quarantine. For the second category, again, these people will need to have completed the vaccination, but they have to be close contacts of people who have been infected with the mutant variant. For these close contacts, they need to satisfy 3 conditions. And having satisfied those conditions, the quarantine period could be reduced from 21 to 14 days. And 14 days after the quarantine, they would need to, implement 7 days of self-monitoring. And also on the 19th day, they would need to go to the community testing center to take a compulsory test. So what are these 3 prerequisites? They have to prove that they have been vaccinated, 14 days of lapse, and secondly, on day 1 at the quarantine center, the 7th day, the 12th day, the samples that they provide will need to be tested negative. And thirdly, like I said earlier, the antibody test will need to be positive. Overall, there are for these 2 categories of persons who have completed the vaccination, the advisory panel and the expert panel's consensus, basically, that is the consensus. Now, based on our overall consideration and in implementing these recommendations, we would adopt a prudent approach and do it in a step-by-step manner. So for cases, the close contacts which do not involve patients infected by the mutant strain, the quarantine, such person will still need to undergo a 7-day quarantine at the quarantine center first. Finally, I also like to remind you that we're still facing a very serious threat posed by the epidemic, especially the threat of the mutant strain. So I hope people will stay vigilant. If there are any slight symptoms, they should seek medical advice as soon as possible.
Permanent Secretary. The Chief Executive on the 12th of April announced the new direction of fighting the pandemic. The government, after listening to the recommendation of the advisory panel, think that there is room to make adjustments. Those arriving in Hong Kong, if they have completed their vaccination, can have the quarantine arrangements adjusted depending on the risk level of their place of origin. Apart from those coming from extremely high or very high risk areas, those who come from outside of Hong Kong and those who have been vaccinated can have their quarantine period shortened. That includes Hong Kong residents coming back. At midnight tonight, there was the quarantine arrangement adjusted grouping on boarding and compulsory quarantine requirements. There are a number of groups. A1 and A2 are extremely high, very high risk areas. Group B, very high risk areas. Group C, medium risk level area. Group D, low risk area. Barring any major change in the epidemic situation, we will make adjustments starting from midnight to the 12th of May in relation to the quarantine period for those who have completed their vaccination. I'll now elaborate, starting from Group D, i.e. low-risk areas, currently covering Australia, New Zealand and Singapore. Currently, arrivals from these places will have to go through the 14-day compulsory quarantine period at a designated hotel. In the future, those who have completed their vaccination will only have to go through a 7-day compulsory quarantine period at a designated hotel, plus 7-day self-monitoring and compulsory testing on the 12th day and the 19th day. For Group B and C, that is, high risk and medium risk areas, currently, people arriving from these places will have to go through 21-day quarantine period at a designated hotel. In the future, those who have completed their vaccination will have to go through 14-day quarantine period at designated hotels, plus 7-day self-monitoring, and after they have completed their compulsory quarantine, get tested on the 19th and the 26th day. For Group A1 and A2, that is extremely high and high risk areas. For Group A1, they are places where flights have been suspended and boarding from these places to Hong Kong have also been prohibited. For Group A2, arrivals will have to go through quarantine period of 21 days at a designated hotel. Those who have been inoculated with the vaccine will have to go through the same quarantine period as those who have not been inoculated, i.e. there is no shortening of quarantine period. In relation to people arriving in Hong Kong who have been vaccinated and their shortened quarantine period, if they have stayed in China and related places, that is the mainland, Macau and Taiwan, if they do not come to Hong Kong under the Return to Hong Kong scheme, they will have to go through the home quarantine of 14 days. Starting from the 12th of May, for those who come from places outside China and have been vaccinated, the quarantine period will be shortened from 14 days to 7 days. Afterwards, there will be a 7-day self-monitoring, and on the 12th day upon arrival, they have to go through the compulsory testing. Such an arrangement applies to those arriving via land boundary points and the airport. By those who have completed the vaccination, I mean those people who have 14 days before arriving Hong Kong completed the vaccination program, the necessary number of doses required for the vaccine, and they waited 14 days before arriving in Hong Kong. If they are vaccinated outside Hong Kong, apart from the authorized vaccine in Hong Kong, that is the 2 types, we also accept vaccines on the WHO emergency use listing of WHO pre-qualification list. We also accept vaccines that are approved by the National Medical Products Administration or the stringent regulatory authorities of WHO. The list of accepted vaccine will be uploaded to the thematic website of COVID-19, and the information will be updated regularly. I'd like to take this opportunity to say this. We have been enhancing the testing arrangements for people arriving in Hong Kong. Apart from testing before boarding and upon arrival, that is landing, depending on the grouping by risk level and the applicable quarantine period, we also require testing on the 3rd, 5th or 7th day, 12th day, 16th day, 19th day, and even 26th day. Dr. Ronald Lam mentioned about local close contacts and people who we deem to carry a risk. They will also be subject to compulsory testing. We don't want to miss anyone. Let me give you an example. People coming from extremely high or very high risk places, they have to get tested on the 1st, 3rd, 7th, 12th, 19th, and 26th day. The 26th day is the testing after they have completed the compulsory quarantine period. Those who have been vaccinated and coming from medium to high risk areas, they have to go through 14-day quarantine period, and at the same time they have to be tested on the 3rd, 7th, 12th, 16th, and 19th day. They finish the quarantine period on the 14th day. Afterwards, they will have to be tested 2 times more, that is the 16th day and the 19th day. Those who have been vaccinated and coming from low-risk area, they will have to go through the 7-day compulsory quarantine period. On top of that, we will require them to be tested on the 3rd, 5th, and the 12th day. The 12th day testing is done after they have completed the quarantine period. All these enhanced testing arrangements aim to catch everyone even after the adjusted quarantine period. Thank you. Now the floor is open for questions. Please use the microphone. Keep your number of questions to under 3. Identify yourself and the organization first.
The 4th row, the lady in red. Good afternoon.
即係話而家喺檢疫中心檢疫緊嘅，包括係荃威花園、豪峰嘅居民咧，佢哋全部都即係嚟緊係之後就可以離開呢一個檢疫中心啦。預計係。
Well, does it mean that they can leave the quarantine center? When do you think they can make arrangements for them to leave? An expert mentioned that in relation to data of vaccines in protecting against a mutated strain, it is not very clear, and it's not fully verified yet. And now you have shortened the compulsory quarantine period. Do you think it is safe? And what other assistance would you provide to people who are involved? What about those who are subject to self-monitoring? Will they receive calls from the Department of Health? And how do you keep the gate? Well, first of all, let me tell you why we think there is room to adjust the quarantine period. We have taken into account a basket of factors. You may recall that for the first batch of people under quarantine, those from Parks building, Well, the building itself is not desirable. I mean, in terms of the living environment, there are a lot of subdivided units. Residents of the whole building have been sent to the quarantine center, but we have not identified any new cases. And in terms of epidemiological investigation, we see that this time round, the mode of transmission of the mutated strain take place in a domestic setting and among people who have let their guard down. Say, for example, they attend parties or gatherings in a home setting. In relation to community transmission, using the case in Tongchong as an example, we have set up a lot of specimen collection stations in the community. This is to enable members of the public to get tested, and we have not picked up any positive cases, and there are a number of buildings that are subject to the restriction and testing declaration. We have not identified any confirmed cases. Taking stock of all the data, we think that self-monitoring period plus an arrangement taking into account of the risk level may be suitable. So those who are staying in quarantine centers, we plan to let them go back home in an orderly manner. But before they do that, they will have to be tested to ensure that all results are negative. Since we hope to achieve this in an orderly manner and in a gradual manner, we do not want any queues, we don't want any chaos. So we will make arrangements in the coming few days. In relation to people who have received the full course of vaccination, that is 2 doses plus 14 days. The scientific committee has taken into account all data, including those from overseas, as well as data of efficacy of CoronaVac and Comirnaty. The vaccines will reduce the chance of serious case upon an infection, and it will also reduce the viral load. There is plenty of scientific data showing that the viral load and the risk have been lowered. Given such data, close contacts, if they have completed the full course of vaccination, can be subject to a shortened quarantine period plus 7 days self-monitoring. That is appropriate. The scientific committee has been cautious. They've added an antibody test to make sure that there is the production of antibody in the body before the quarantine period is shortened. After taking all that into account, they've decided that it is suitable to shorten the quarantine period. If it is a non-mutant strain, the period will be shortened from 21 days to 14 days plus 7 days self-monitoring. The entire period is still 21 days. It's 14 plus 7. The 14 day will be spent in a quarantine center. The 7 day self-monitoring period is done at the place of their choice. They will be subject to testing on the 19th day. Those who have come into contact with, just now what I was talking about the mutated strain. For non-mutated strain is 7 plus 7. That is 7 day compulsory quarantine plus 7 day self-monitoring. that is so there is still there is on top of that a 12-day compulsory testing. That is in the case of a non-mutant strain. The scientific committee is of the view that it is a cautious approach based on scientific data and an attempt to strike a balance.
Regarding self-monitoring, we already have some guidelines already, and that is during the period of self-monitoring, they have to stay vigilant about whether they have any symptoms, observe hand hygiene, and implement all the anti-epidemic, measures and minimize social contact. Together with compulsory testing, under the circumstances, we hope that on the one hand we can have the flexibility, while at the same time when symptoms appear, we will be able to discover them as soon as possible. I'd just like to add one point regarding vaccination. I think if you look at our new direction on fighting the pandemic, we hope to use the vaccines. We have the vaccine bubble. We have announced that we have made announcements regarding the arrangements for the vaccination period. If you look at the rest of the world, I think vaccines is still in shortage in some countries. In Hong Kong, we have adequate supply of vaccines, and I think we should make full use of this very useful tool, so that whether it's for ourselves or for our own community, we'll be able to build up this protective shield. The vaccination program this time, and also our ability to shorten the vaccination period, other than the scientific justification, and our scientific committee have been satisfied that we have the conditions to do this, and of course we have to satisfy those three conditions. At the same time, we need to continue with our risk assessment and also build safety nets. So upon the completion of quarantine, so there will be compulsory testing after the quarantine period, together with self-monitoring. So we will continue to monitor the overall situation. The fourth row, the lady at the far corner. I'm from TVP. Dr. Lam said that we have this new arrangement which is premised on the current experience and what we learned from individual cases. So the threat to the community is not very high. But I think this arrangement does not just apply to on the current transmission link. If we have a next round of transmission, will there be a gaps resulting in the outbreak of in the community? And secondly, regarding the vaccines, for people who have already been vaccinated, they may still be they may still be infected even though they don't have serious symptoms. So if you shorten the vaccination period and when these people return to the community and they become infected, would that become a second gap? And secondly, you said that you would require these people to continue to be tested upon completion of quarantine. But Professor Yun already said that there might be problems with the quality of the tests and the samples are not properly taken. So would you heed the advice of Professor Yun to actually review the findings of cases which have been tested negative? Dr. Lam. I think we have been emphasizing that we've looked at all the relevant data, we've studied each and every case, and now have come up with this adjustment. Well, I've already stressed just now that if some of these confirmed cases involve, close contacts or family members of the infected. Now, if the living environment of the case in question is not very satisfactory, let's say the subject lives in a subdivided flat or on the same floor, the residents use the same communal facilities which everybody living in the premises can come into contact with, then we will not rule out the possibility that we will actually, apply more stringent, quarantine requirements. or sometimes you may have more than one case being identified in the same premises, in which case we will carefully consider if we should require all the residents in the entire building be quarantined. Now, if that, we also look at whether or not the case is a case with no origin. So for each and every case, before we can trace the origin, we will adopt the most stringent approach. But having several rounds of preventive measures, and we've also been able to identify the transmission link and found out about the mode of transmission, and that's why we've decided to propose these adjustments. Of course, the virus may keep changing all the time, so we will closely monitor the development and come up with the adjustments necessary. Regarding the vaccines, the scientific panel and the expert committee have looked at all the data, the experience in other countries, and the effect of the vaccines in helping build a protective shield. Whether in countries like Israel, the US, and the UK, if you have a high percentage of vaccination, you'll find that the number of infections had dropped rapidly. So from the macro and micro level, we have seen that the vaccines have been very effective. Especially the science committee have already looked at the vaccines that we are now administering in Hong Kong, namely BioNTech and the CoronaVac vaccine. They have both. well, we have. So we are now proposing to shorten the quarantine period and also implement the self-monitoring requirement. Now, regarding testing, I think first of all we should note that we've conducted a large volume of testing, and we have been monitoring the percentage of positive cases, and we have found that the percentage of cases which have tested positive have been quite so we still find these positive cases, and that's why we have continued to implement the segregation measures. Now, regarding testing, for the private laboratories, we do have a quality assurance scheme. From time to time, the Center of Health Protection, the labs under the CHP will, from time to time, submit samples to these labs for testing to ensure that they will be able to accurately, test whether or not the sample is positive or negative, and also the viral load level. At the same time, for individual labs, we will engage a third party to conduct a validation process or a review process to ensure that the whole procedure carried out at the lab will have the required or necessary quality assurance, so that we can ensure that there is quality assurance. In the designated quarantine hotels, that is also one important part of our anti-epidemic measures. There have been some recent cases which show that at these quarantine hotels, certain infection control measures have found to be imperfect, and that's why we are now conducting a comprehensive review of the infection control measures at these designated hotels and their testing arrangements. After we have conducted a comprehensive review and come up with some improvement measures, we will have announced the details. Regarding the process of taking samples, for the persons who are responsible for taking the samples, regarding the qualification and so on, we will be tightening the requirements. We will now, from now on, require people who take samples at the designated hotels will need to be professional nurses and who have to have undergone training. So this is one example to show that we are now taking a comprehensive review of the quarantine hotels so that we can enhance our, testing and also anti-infection measures. An English question.
Good afternoon. 3 questions from RTX English News, mostly to Dr. Lam. First question, whether you think the previous rounds of evacuation is kind of overreacted when those who have previously been ordered a 21 days quarantine can leave after they tested negative under the new measure. And the second question about self-monitoring, is this a total honest system? If residents do not comply or follow the measure that you have suggested, will there be any legal consequences? And the third question is, can I know how and when or which stage will the antibody test being conducted and how long it needs to obtain the test result? Thank you.
Dr. Lam, please.
Okay, thanks for your question. We have to adopt a very prudent approach with respect to the importation of the variant of concern, what we call the mutant virus strain in Hong Kong. So as such, we also noted from our investigation that most of the cases at that time were of unknown sources. So and variant viruses are known to increase in its transmissibility, increase in severity of infection, as well as with prolonged incubation period. So with respect to the characteristics of such viruses, and we are unsure where they contracted the diseases, then we have to adopt the most prudent approach and most stringent measures. As such, we have decided to put all the residents within the same building to 21-day quarantine in the quarantine centers. And this is not only for the health of the residents, but also to prevent its further transmission within the community. So definitely this is not an overreaction, but a very cautious approach to protect the health of Hong Kong. And as regard to the self-monitoring, we do, in fact, according to our experience, because self-monitoring have been in place for a number of other scenarios. And most of the Hong Kong citizens are quite, I would say, compliant and also supportive of the measures. And we also subject them to the compulsory testing in the current scenarios. So we think that these kinds of measures, plus that they have completed the full course of vaccines, could help to assist in the overall measures. Mind you that the scientific committees, the expert advisory committee, panel members have reviewed very comprehensively both overseas data and also the data provided by the manufacturers. So they are quite confident that the current 2 vaccines in use in Hong Kong could have that kind of protection and help to address the issues of reducing the transmissibility. So I think this is an approach, but of course we will continue to monitor the data and update the recommendations as appropriate. As regard to the antibody testing, under the current, the close contact of the cases would be put under quarantine immediately. That is the same as what we are doing now. And then once they are put under quarantine in the quarantine center, we would ask them for the proof of documentary proof for the completion of the vaccination plus post 14 day, and also perform the PCR testing and negative, and the antibody we would as soon as possible, we would draw the blood samples from them and perform the serology test. Usually, depending on the number of tests required, usually an antibody test would take a day or two. Right. Thanks.
下一條
Next question. Third row, the lady in white. I'm from Hong Kong 01. I'd like to ask, experts said that, shortening the quarantine period after vaccination is not supported by science. And you have to use the household as a unit by having the entire households getting vaccinated before you count them. Well, now for you will wait for 2 cases before you will check the environment of the building and the domestic setting. Well, why don't you start with the preliminary case and start testing and checking? Is self-monitoring effective? Well, apart from vaccination, those who have recovered from the illness also have antibodies. Well, will you shorten the quarantine period? A friend of 11672 has been to Deepwater Bay. Well, does it mean that close contacts of confirmed cases have to go to quarantine centers? Professor Chan, we have said a number of times that those people who have completed 2 doses of vaccine plus waiting for 14 days, the quarantine period will be shortened. The Joint Scientific Committee has reviewed overseas data and evidence before making the recommendation. I will defer to Dr. Lam shortly. Apart from vaccination, you mentioned, well, the CHP has explained about the contacts of mutated strain. They have explained about the adjusted arrangement. You can rest assured that everything is done with caution. We have looked at the evidence, we have taken stock of our experience and a large volume of data. Residents of the first block of flats with a confirmed case, they have been sent to a quarantine center. On top of that, we have done hundreds of thousands of compulsory testing. So the decision to make adjustments is based on sound evidence. It is done based on a risk. We look at the environment of the building and a number of other factors. I'll defer to Dr. Lam. The more people who have been vaccinated, the more the benefits. So we encourage the entire household to get vaccinated. If there is an untraceable case, especially one of mutated strain, we will be very concerned. We will conduct assessment, say for example, testing done in the sewage system of the building. We look at the general environment of the building. We look at the ventilation. We don't wait till there are more than one case before we take action. We aim to make a very precise assessment. This time round, we have found the first case of mutated strain in the community. So we have to start on this most stringent side in order to curb possible transmission. We have taken stock of what happened in the past 2 weeks. We decide that we can narrow the scope and put in place targeted measures in relation to the deep water bay gathering. Whatever the form of the activity is, these are social gatherings, so the anti-infection measures or infection control measures are quite lax. People will be eating and drinking and they won't be wearing their mask. Second level contacts will be required to undergo testing. And if it is a mutated strain, and if there is another variant, then we don't run the possibility of multi-level tracing.
Last 2 questions. Go ahead.
Morning Post. Professor Chan, is the mutated strain of the virus contained at this point, given that you have shortened the rules for quarantine? Is it contained at this point? And was this decision based on health assessment, or is it because of the public pressure? If there is a mutant strain again, what will be the protocol? For Dr. Lam, which buildings exactly will be released from quarantine? Is it always Cornhill, Caribbean Coast, Royalton, and Hinghua in Taiwan? And by when will this operation start? And by when will all the residents be sent back home for the self-monitoring and testing procedures? A few more questions about the fully vaccinated arrivals to Hong Kong. Where will the antibody test be conducted in the city? Is it in Hong Kong? And what about the single dose of Johnson & Johnson vaccine? How will you verify those documents? And what type of documents do people need to produce?
Thank you. Professor Chan first, and then Dr. Lam, and then Mr. Chen, please.
Okay, first of all, thank you for your question. This time, as we have a new direction for our pandemic control, under this new direction, actually, vaccination is the basis for our relaxation. And we always emphasize the relaxation must be a safe relaxation. And so that's why this time, our announcement on having full vaccination, that is people who are fully vaccinated, and if they are a close contact, then for shortening the quarantine, first of all, it is scrutinized. The data and also the recommendation is made by the Joint Scientific Committee under the Center for Health Protection. Secondly, other than shortening the quarantine measures, we put in a number of safeguards into the shortening. That is, not only are we shortening slightly the quarantine period, we put in place a number of tests in different periods, both before and also after they leave the quarantine center. Third, the shortening would not be realized unless they meet certain requirements. And Dr. Lam has already said earlier about the 3 requirements that is necessary. So the whole situation is being scrutinized and discussed by the Joint Scientific Committee with scientific data, and also scrutinizing different experiences and also data from not only in Hong Kong but also around the world. Of course, we will continue to monitor, the situation and continue to assess the risk of the situation.
The new measures or new quarantine arrangement will come into effect tonight. So the principles are including for those who are currently under quarantine, they need to have a negative test on basis of PCR for COVID-19 before they can be released back into the community. So that is applied to all situations. If currently there is an estate, for example, or housing block, which just undergone the test RTD restriction testing declaration, and all the results are come back negative, then this updated quarantine arrangement can apply. Thanks.
Mr. Chen, please.
Sorry, let me supplement. Now, today we talk about adjustment to two separate sets of quarantine arrangements. What Dr. Lam has just mentioned are the quarantine arrangements for close contacts. So the criteria that he has mentioned about fully vaccinated, PCR test negative, and also positive antibody tests, those pertain to the quarantine arrangements for close contacts. Let's make it clear. And as the Joint Scientific Committee has recommended, those will be differentiated between close contacts of cases not involving variants of concerns and those involving variants of concern. So let's put that aside. The other sets of quarantine arrangements are the quarantine arrangements for inbound travelers. Those are being shortened on the basis of the risk assessment of the countries of origins of the travelers. So what I've mentioned earlier about the differentiation or the categorization of places into different risk groups, and we are shortening the quarantine arrangements according to the risk groups. So for these inbound travelers, what we would require are only fully vaccinated and also PCR test negative. Depending on the where they come from, those will be either pre-departure tests or arrival tests at the airport or both. And that would be the only requirement. There's no antibody requirement test for inbound travelers. Thank you.
好，我哋答多最後一條問題啊。
Take one more question, perhaps. The lady in a yellow jacket, third row. I'm from the Ming Pao. Regarding the close contacts, after taking the vaccines, the quarantine period will be shortened. Would it be effective since midnight today? For people who have already been vaccinated, will they be able to leave the quarantine center once the time is up? So for people who discover that they have symptoms, should they go immediately to the hospital or what? In the testing of antibodies, is it that different vaccines will produce different types of antibodies? So what kind of antibodies will you be looking for? What should be the concentration level of the antibodies, or is it that, so long as there is antibodies present, it will suffice? And also for the antibodies, the capacity for testing these antibodies, how many organizations can do that, and how many such tests can we do? Let's say if you have more than 1,000 people who need to be tested, will you be able to cope? And just now, you said that, so why is it that people who are vaccinated will need to be tested for their antibodies? Why is it that this does not apply to our arrivals to Hong Kong? And how can we authenticate the record of vaccination? Some experts have also said that if we were to shorten the quarantine period, is it the case that in future you can do away with quarantine altogether? So after people have been vaccinated, so under what circumstances will people not have to be quarantined? Upon arrival. Now, regarding the antibodies, the recommendation of the scientific committee is that there are different types of antibodies. First, you have the RTG, that is the spike protein, or the IgG. Or we also have the mRNA vaccine. Very often, the spike protein is the main target that we looked at. Next we have the surrogate neutralizing antibodies. Regarding the concentration level and by how much should the antibody should be increased, the lab should have the numbers, but I don't have that with me. But there are objective guidelines or indicators for these antibodies or for such tests. With these tests we can distinguish whether the antibodies are formed after infection or the antibodies are formed or created as a result of vaccination. Whether talking about our capacity, actually the 6P and the HA should be able to do that, but we will steadily step up the effort. But as far as vaccination is concerned, we have already broken the $1 million landmark as far as vaccination is concerned, and we have the ability to further expand that. Also like to go back to an earlier point. The scientific committee have said that there are two scenarios. First, one is that somebody has been vaccinated and then 14 days have elapsed. Secondly, we're talking about people who have once been infected. For those who have previously been infected and after discharge, and if it is less than 9 months, they are still deemed to have taken the two vaccines. Because 9 months after the infection, there is data showing that the antibodies are still present in the bodies. In the second scenario, the person has been infected a long time ago. It's been more than 9 months, and the scientific committee's recommendation is that for such people, they are recommended to take one extra, dose of the CoronaVac or the BioNTech vaccine. That will be regarded, that they would have then been regarded to have completed the vaccination program.
Let me answer your question about close contact and the difference between that and those arriving in Hong Kong. All anti-epidemic measures are based on risk. Close contacts are, in principle, higher risk. The confirmed rate of close contacts are rather high. For arrivals, it depends on the place of origin's risk level and the state of the COVID situation. So we take into account the risk level as well as the COVID situation of the place of origin. If you don't come from high risk or very high risk or extremely high risk areas, we can shorten your quarantine period. That is done based on risk. I'd like to say that for people coming from extremely high or very high risk places, we will maintain the same quarantine period in order to guard against imported case. We do not allow anyone to arrive in Hong Kong from extremely high risk places. For those that are from high risk places, they have to go through the 21-day quarantine period and get tested on the 26th day. This is to guard against unusually long incubation period. For low risk areas, say for example, Group D areas, New Zealand, Australia and Singapore, the COVID situation at these places are relatively stable and under control. If one has completed the full course of vaccination, we think that the risk is manageable. Even with a shortened quarantine period, they are still subject to the same frequency of tests. So we can still catch any confirmed case by testing. Let me supplement. You talk about a roadmap. We have pointed out a number of times. We have the new direction of fighting the pandemic. We aim to resume normality of our everyday lives. When our everyday lives and business have resumed normal, we will be able to fulfill the aspirations of the general public and that of the government. You ask for a roadmap, I think you mean when measures can be further relaxed, say a further shortening of quarantine period or a complete doing away of quarantine period. We have to take into account technological advancement and how well we are doing. So far, we have reached a vaccination rate of over 1 million people. A lot of them have completed 2 doses. 6 million people in Hong Kong are eligible to get vaccinated. If we can increase the vaccination rate, apart from protecting yourself and protecting your families, we can build a protective barrier in the community. This is conducive to the resumption of normal lives. Once again, I make an appeal to the general public. Updated information has been disseminated by the Center for Health Protection in relation to vaccination. I hope you will get more information. If you're waiting, please don't wait too long. We may have a sufficient supply of vaccine, but we have previously announced that for Comirnaty, some of the centers for offering Comirnaty will cease to operate by the end of September. So please complete your vaccination course before then. We hope that we will be able to move ahead with that. That's the end of the press conference.